Bites and stings. So there's many different things that can cause bites and stings, from mosquitoes, bees, wasps, spiders, just to name a few. With the bite, when you first get bitten, the best thing to do is try and remove the bite and sting, wash the area with just soap and water, and then apply a cold compress to the area to help take down the reaction and swelling. Sometimes these can cause red, swollen, painful areas that also become itchy. Most of the time these are only mild and should resolve themselves in a couple of days. Sometimes some people, however, can develop a mild allergic reaction that can take slightly longer to cure, around about a week. We have many different products that can help the symptoms of bites and stings. So we have one-day antihistamines, but the preferred would be chlorphenamine, which you can take every 4 to 6 hours and is better at taking the reaction down. With chlorphenamine, this can sometimes cause drowsiness, however, but it is better at taking down reactions. So if patients can tolerate it, taking that every 4 to 6 hours is the best thing. If drowsiness is a problem, or a patient is driving, for instance, then the one-a-day antihistamines will still give some relief. If patients would prefer a topical preparation, there is Anthasan, which is a topical antihistamine cream, which can be applied to the area. We also have some other topical preparations. So for very bad bites and stings, hydrocortisone is great at taking down the inflammation and the itchiness. That can be applied twice a day for a few days. We also have Urax, for instance, which is an anti-itch ingredient, and they also formulate one Urax HC, which also has the hydrocortisone in. So with that cream, you're getting 2 different ingredients to help relieve the itch and the symptoms of the bite. Sometimes some bites don't resolve and patients can get an infection from the bite. So if the redness is tracking from the area and the area is not getting smaller, it's more swollen, maybe bigger than sort of a 10 centimetre square size, getting bigger and moving from the area bite site, then it's worth seeing the doctor or nurse, as you may require antibiotics to resolve the problem. Also, you do have some insects that can cause other problems. So obviously mosquitoes, if people have been travelling, you do have the risk of malaria, and also from ticks you can get Lyme disease. With removing ticks, the best thing to do that is very carefully. You can use tweezers, or many pharmacies sell a tick removing device. Have to do this very carefully, and also be careful not to squeeze the tick, because that can cause the risk of infection with the ticks.